In this video, I will be talking about term versus preterm newborn and how to identify them, means whether they are term or preterm. So preterm means babies who are born in less than 37 weeks of gestation, and term means babies who are born after 37 weeks of gestation. So if a baby is born in 36 week plus 6 days, it is still considered as preterm. Okay, so posture of limbs, in case of preterm babies, the posture of limb is extended due to decreased tone of the muscles, right? So the babies will be like this. The tone of the muscles will be less, but in case of term babies, due to increased tone, the posture of limbs will be flexed, right? The babies will be like this. Okay, due to increased tone of muscles. Arm recoil, since there is increased tone, the arm recoil means if you want to straighten the arm, it will again come back to its position, right? So it is present in case of term. In case of preterm, the arm recoil is absent. So now comes the popliteal angle. Popliteal angle means the angle between the thigh and leg. Okay, so clearly see this here clearly. In case of term baby, since the tone of the muscle is high, so the angle between the thigh and the leg is acute, that is less than 90 degree. Okay, so popliteal angle in case of term babies is acute, and in this case, see the image, the angle between the thigh and the leg is supposed to be more than 90 degree. Okay, it is more than 90 degree, so it is obtuse. This angle more than 90 degree, or acute angle is less than 90 degree. Okay, in case of term babies, head is size of head is approximate with size of body, right? In case of preterm, the size is larger, head is larger, means compared to size of the body. In case of hair in case of term is black, silky, and it is not easily pluckable. It is, in case of preterm, it is easily pluckable. Okay, so skin in case of newborn, in case of term, color is pink. In case of preterm, color is reddish. Body hair, in case of body hair or the lanugo hair, in case of term is less abundant. In case of preterm, it is more abundant. Lanugo hair is important, more abundant, or simply abundant. Hair in case of term is well formed, right? And cartilage in case of preterm, it is not well formed. pinna recoil. In case of term, the pinna recoil is present due to well-formed cartilage. Pinna recoil is present. In case of preterm, since the cartilage is not well formed, so pinna recoil is absent. This is term. Preterm. Okay. Scarf sign means elbow crosses midline. Since in case of term the tone is high, so the scarf sign that is elbow does not cross midline. But in case of preterm, since the tone is less, elbow easily crosses, that is scarf sign is positive. Breast bud, in case of term it is more than 5 mm. In case of preterm it is less than 5 mm. External genitalia, these are last two important. External genitalia in case of female, in case of term, right? In case of term, the external genitalia only labia majora is seen because labia minora is hidden by labia majora. Is hidden. But in case of preterm, this is very important. In case of preterm, both labia majora minora is seen. In case of male, in case of term, the scrotum is pigmented, as well as scrotum contains testes, right? In case of preterm, this empty scrotum due to non-descending of testes, right? Scrotum is empty if it is less than 36 weeks. As well as this scrotum is less pigmented.